Welcome to another episode of Time with Dr. Adams. Thank you for subscribing to my channel. Thank you for liking. Thank you for sharing. In my previous video, we talked about the importance of going to antenatal clinic, A&T. Thank you very much if you are going. Thank you, mommy. Thank you, daddy, if you are escorting mommy to the A&T. In this video, I want us to talk about the importance of the medications we take when we are pregnant. Please, like I already said in the A&T video, do not copy medications. You do not know what is wrong with your neighbor, your family, or your friend. You don't know the reason why that person is taking that medication. So please, do not copy medications at all. Go and ask your doctor, go and ask your midwife to prescribe what is needed for you and your baby. Now, during the first trimester, what we take in, the medications we take in, actually directly affects our babies. And I repeat, during the first trimester, that is from week 0 to week 12, everything we take in, every medication we take in directly affects the babies. Why? Because during this first trimester, that is when most of their body parts are being formed. Okay, so let's go straight to some of the medications. I cannot talk about all the medications here, but some of the important ones. We are starting with folic acid. We actually advise that if you are planning to get pregnant, start taking your folic acid, 40 microgram daily. Start taking your folic acid. Why? Because folic acid prevents your baby. We have something we call neural defects in babies. They are birth defects. Now you can see from the picture shown here what I'm talking about. Folic acid prevents neural birth defects in children. Example, spina bifida. So when you take your folic acid, it's actually good for you before you get pregnant, and especially in the first trimester. You can take it during the whole 3 trimesters or the whole 9 months, but it's very important in the first trimester. We actually advise that mothers should eat well-balanced diet. Stay away from caffeine, stay away from smoking, stay away from drinking, and make sure that your meal in a day has all the nutrients that you need. Because now we do not encourage people to say, I'm eating for myself and for baby. Just eat a balanced diet with your baby in mind. You are not eating for two, like some women will say, I'm eating for two, so they will overeat. No, just eat well, make sure you are full. However, eat a well-balanced diet. Now, these foods that we are eating, when you go to the hospital, we tell you that we can give you supplements. They are supplements. It means they are going to add up to what you are eating. That is why we need you to eat a balanced diet. Now, there are women who can vomit throughout their whole pregnancies. I, for one, I vomited throughout the whole 3 trimesters. It doesn't mean you're also going to vomit. However, I also taking these supplements like I said. Now, if you go to the hospital, we'll check your HB, and then if you are in need of more ions, we give you iron supplements. Iron supplements goes with vitamin C. So sometimes you can see that your doctor will prescribe iron supplements and then add vitamin C to it, or you can naturally eat your vitamin C's as well. We have multivitamins. Do not bother your head about buying these expensive medications. You know, I do not want to mention brands because I'm not promoting anyone's brand here. However, there are some women, when they get pregnant, they are very particular because their friends and their families have told them that this particular brand, buy it, it will help you. Someone said one particular brand of multivitamins for pregnant women will make your baby fair in complexion. It is not true. Being fair in complexion is just genetics. So medications, yes, we have bad medications that can do that. However, these multivitamins, someone said it will make your child's hair curly, and that multivitamin was actually very expensive. No, whatever you can afford, please buy. Do not overstretch yourself. Do not try and buy anything too expensive thinking it will do. The basis is what your doctor will give you. Now, if you write this medication and you say you cannot afford it, your doctor can actually change it. So multivitamins are supplements that add up to the foods you are eating, the balanced diet that you are eating. So I've already talked about folic acid. I've talked about the iron supplements, and the iron supplement goes with vitamin C. Now we talk about calcium. There are special calcium supplements around. If you do not have money, please just eat foods that have lots of calcium, like milk, egg, and all that. Any anything that has calcium will boost your calcium levels. If you do not have money to buy any of this branded supplement, iodine is also good for the neural development of the baby. So where can you get iodine? Making sure you are eating iodinated salt, and then you are eating foods that contain iodine, like seafoods, you will be fine. Vitamin D, there are lots of supplements in all these medications that we get from the hospital, but the basis is make sure your midwife prescribed for you, or make sure your doctor prescribed for you. And when we are pregnant, we are also given anti-malarial medications. Please, those anti-malarial medications, do not go to the pharmacy yourself and buy, because we have a specific one we give to these pregnant women. It does not mean these pregnant women have malaria. They are prophylaxis. Prophylaxis is, they are preventive. Prophylaxis, preventive. So we are trying to prevent malaria in these pregnant women. So do not go and buy any anti-malaria from a pharmacy or countertop and try and self-medicate at home. No, we have special ones. And even the special ones that we have, I spoke of G6PD in my ANC video. Now, mothers who have G6PD, who have full defect or even partial defect or G6PD, they have some special kind of anti-malaria they cannot take, or they should not take. That is why you do not need to just go to the pharmacy and buy yourself. Let your doctor prescribe for you, because your doctor will see from your antenatal book, from the history, that whether you have G6PD, you have no defect, partial defect, or full defect. We also give dewormers. Yes, when you are pregnant, we also give dewormers. These are all prophylaxis. Other thing, we also give a tetanus shot. Yes, we have a way we calculate it. I do not want to tell you here, because I want you to go to the antenatal clinic. And when you take your book at home during your leisure time, just go through the book and make sure all these things, they've indicated when you are supposed to get all these things. And even if you haven't received them, when you go to the hospital, you can ask your midwife or your doctor that, I see I'm supposed to get tetanus shot here, I haven't received it, when can I receive it? When you go to the hospital, ask questions. Ask questions, because this involves you and your baby, and we want you to have a healthy baby. So like I said, we have already talked about folic acid, which is very important before pregnancy, during pregnancy. Folic acid is very important. We've spoken about the iron supplement that goes with vitamin C. We've spoken about iodine, vitamin C. You can find all this in just one tablet. We have some tablets that contain omega-3 and all. They are all very good. But please do not stretch your boundaries if you cannot afford it. Your doctor will prescribe a simple, or let me say a cheap multivitamins for you to take. Just eat well, and these medications will become a supplement. If you have any questions, please leave it in the comments below. If you want me to cover any specific topic, kindly let me know. Thank you for watching. Subscribe, like, and share. See you in the other episode. Bye.